Well, good evening, everyone. This is Dr. Ella Thorpe with Tustin Longevity. Talk to the doctor or ask the doctor a question. We are here every Tuesday at 6 o'clock sharp for most of the time. And our goal is to make another resource available where our patients, our family, our friends, your friends and family can have access to talking with a doctor and putting general questions out. We are a group of physicians here at Tustin Longevity, 6 of us, soon to be 7. And our goal is to take our combined functional, integrative, complementary experience in medicine with our standard medical degrees, training, residencies, and experience, and tell you how we would look at a question that you might have about staying well, preventing health, trying to restore your health, and just make a resource available to you. There are so many questions, and I've been practicing medicine 41 years, so we're trying to give you a practical, real life response. To that end, we have emails, and so I have a couple of pages of questions here that are sent to me. I just had them handed to me, and so I never get a chance to pre read them or screen them. The other thing is you can have a chat here on the YouTube. You can type in your question in the chat and we will get to those. We'll start with the chat today because very often I start with the emails. If you are on our email list and you're alerted to the fact that reminding you will be meeting at 6 o'clock, you'll see in the email itself a statement, email at this site in your email for the the Tuesday night Ask the Doctor. If you just send it to our general email here at Tustin, we have so much email that it might get lost. So if you're on our email list, then you'll see it come up to remind you about this, and use that link there, and then you'll be sure to get your list to me so I can try and do my best at answering. I'm not saying I have all the answers. I'll do my best. If I don't know, I will tell you I don't know. Oftentimes, if I have time, I will try and look things up in the meantime because I do learn from my patients as well. So, with all that said, I do want to remind you that this is not meant to be personal, individual advice. This is general advice to the public. If you're a patient here and you do have a question or a concern, please call us at the office during office hours at 714-544-1521. Tell the front office reception what your question is, who your doctor is, so that they can get your question and answer you appropriately with your chart and access to that. So let's begin tonight with the chat group, and we'll start there with Eli. Hi, Eli. Uh, his first question is, can you find ortho-digoxime outside of a functional integrative doctor's office clinic? I found it being sold on Amazon. Do you think it'd be safe? I just found out I'm a blood type A positive. My suggestion is not to use Amazon. We don't know how long it's been left in some heated environment on the back of a truck or on the home or wherever it's been. And so heat can destroy enzymes. So ortho molecular products are only sold to physicians. Now, I do have I do have orthodigestive enzymes that are similar, and it's private labeled. And so you could call the TLC Vitamin Shop at 714-544-1521, and you can obtain fresh, properly managed, kept in a safe, cool environment, all our nutraceuticals for your health and consumption. Now, the OrthoDigeszyme is put out by Orthomolecular, and they want to make sure that their products are not um, sold on eBay or Amazon and abused or stockpiled or whatever happens in this world on the internet. They want to make sure that their quality assurance and effectiveness is not interrupted. So from their production to their shipment to the physician, it is under a controlled environment, and that physician then knows they can dispense it to their patients. So that's why we do that, Eli. But since you're a blood type A positive, that's exactly what I just took. I took my orthodigestive enzyme, and I have my own orthodigestive enzyme as well. And I just used it because I ate before this meeting so that I'm not eating late at night. And then Eli says, "Thank you, Dr. Althorpe. God bless you, and praise be to God." Indeed, we praise him greatly, especially in today's world with so much going on, and those dear souls in East Palestine, Ohio, after that horrible chemical exposure. So we are our brother's keeper, and we need to lift them up in prayer and do anything we possibly can to help our neighbor to stay well and healthy. And that's why we do things such like this. I guess there aren't any more questions right now on the chat. Maybe there'll be more in a little bit. So let's go ahead to the first one I have is the first two come from last week on the Valentine's Day, February 14th. They got in under the wire before the questions were taken off. This is from Veronica, and she asked the question, "Hi, Dr. Rita. I was just told by my doctor that my liver enzymes are elevated, and I am concerned. These are the results of my last lab test. The SGOT or AST is at 59. That's not a very high level of elevation. The SGPT or ALT is at 97. Again, that's a mild elevation. What do you recommend your patients to lower enzymes? Thank you for your time and blessings." Amen, Veronica. I would suggest that you would take alpha lipoic acid. Alpha lipoic acid helps with sugar metabolism. It is a powerful antioxidant, and it is extremely supportive to liver function. I wouldn't drink any alcohol. I would probably go on a fast for 24 hours, and I would eat a healthy, simplistic one menu day, a rotational diet. We say a one menu day where, if, for instance, I just had salmon, I had broccoli, and then I had some wild rice. Now, a one menu day would mean that I would have tomorrow broccoli, salmon, and wild rice for lunch if I ate a lunch, if I'm eating 2 times in a 24-hour period. And then tomorrow night's dinner, I would reset. Maybe I'll have chicken and green beans for dinner, and then have leftover chicken and green beans for the next day. So notice how that's a one menu day. It's in a 24-hour period. When you eat like that, your gut is not seeing a huge amount of variety and it's very low carb, it's much easier. So I have a chicken vegetable day, a beef vegetable day, a salmon vegetable day, a pork vegetable day, and then I usually have an omelet day. And usually it turns out 2 days out of the week, I'll wind up doing a 24-hour fast. But the long and the short of it is alpha lipoic acid around 500 milligrams twice a day, 400 milligrams twice a day is very healing. There was a scientist physician, I can't recall his name, but there is a mantidine poisoning, mushroom poisoning, that occasionally kills young campers, Boy Scouts who accidentally eat amantadine mushrooms. It's extremely toxic, and he actually would eat amantadine and then during his lecture, and then he would open up a pre-connected IV of alpha lipoic acid, and you could. He just wanted to show you how powerful alpha lipoic was, and you can give it intravenously, but you can also take it orally. Um, what else? I think alpha lipoic acid is what I would do. No, Veronica, I wouldn't drink alcohol. I wouldn't drink, uh, what else? I wouldn't have a high sugar diet. I wouldn't eat late. And then I would retest these liver enzymes within 4 weeks for sure. But if you're having any pain or nausea or vomiting or anything like that, fever, then you'd have to go to the urgent care or emergency room. But these are not uncommon. Unfortunately, today, we are seeing so many people eating so much high fructose corn syrup, so much uh, um, high carb, refined junk food, sugary drinks, that the children especially were starting to find develop non-alcoholic fatty liver disease, and the adults as well. And we're seeing these mild elevations, and it's from the high carbs in our diet. Uh, so that's how I would answer that question, Veronica. Let's see. Chris is also from February 14th, and she says, or has a question. I see a dermatologist a couple of times a year since I have had melanoma in the past. She does a very extensive exam of all my spots. She measures any she finds questionable. She usually wants to scrape off a few spots. I always tell her to watch and wait. My question for you is, if a spot is cancerous, is there a chance it will go away on its own? If I let her take all of the spots she wants to, I would have scars all over my body. I'm not a dermatologist. Melanoma is a serious skin cancer, and squamous cell carcinoma is a serious skin cancer. Basal cell is more common, and it is usually always a localized phenomena that doesn't spread. So I would have to ask you to, Chris, work with your doctor on this and your dermatologist know you don't want to have scraping after scraping after scraping if it's not necessary, and ask and implore your doctor to be using a conservative approach without taking undue risks. Now, on the other hand, I would encourage you to be very low carb. We recommend our patients have a fasting blood sugar under 85, a triglyceride level that is equal to the HDL or lower. That's roughly around 50 or less, because most people's HDL is around 50, 60. But some people have a very good HDL in the 80s, 90s, and at 100. But in general, we like the sugar, carbohydrates, fruit sugars to be around 50 and the fasting insulin to be 3 or less, the hemoglobin A1C to be 5.2 or less. And with that parameter given, I usually don't see people ever emerging or developing cancer. Remember, insulin stimulates growth. And if you're eating a high carbohydrate diet, always calling for your pancreas to squirt out insulin, squirt out insulin, squirt out insulin, you're asking for hormone-based stimulation of growth in you. So I would focus on that, Chris, and you and your dermatologist work out your concerns and so forth. Dorothy is from yesterday. Dorothy asked a question. Let me take a sip. Should I take vitamins and supplements when I am fasting? Well, Dorothy, I do. The only supplement I do not take when I'm fasting is my orthodigestive enzyme. The reason is because I'm not eating anything when I'm fasting. So I don't need to use a digestive enzyme. So Dorothy, I would, and I do. Denise now asks today on the 21st of February, hi, Dr. Ellithorpe. I recently began using estradiol and progesterone creams and noticed that my lymph nodes in my throat are a little painful. Is that possibly connected? I wouldn't think so at all. If yes, should it resolve on its own if given time for adjustment? Thank you and God bless you. No, I think this is totally related to either the dryness or in the air in this time of year when we have our heaters on, the lack of humidity. Always let particles and stuff circulate longer in the environment rather than falling down and out of the environment. So this is more allergens. This is more viral and caused. I would never and have never associated estradiol, progesterone, starting with any lymph nodes in the neck feeling sore. So I wouldn't correlate those two, Denise. I've never seen it. But of course, if things persist and so forth, I would always have things checked out with your doctor who gave it to you. But when I start my patients, I always have them follow up within roughly, a couple, 3 months, so I can see how the new usage is and if there are any questions just like this. Hopefully that helps you, Denise. Pamela asked the question, is bone loss in the jaws common in postmenopausal women not receiving hormone replacement therapy? I just came across a study on osteoporosis, but the authors were dentists and oral surgeons. The article didn't even mention issues in the mouth, just generalized osteoporosis. And a friend of a friend is dealing with sudden issues with bone loss and teeth infections after a normal x-ray and regular dental care. I have been promoting seeking out care at your office for over a year because of her autoimmune issues. Pamela, part of bone health in the mouth depends on healthy dental hygiene. Brushing your teeth twice a day, using a soft brush, not a medium or hard brush, because that'll traumatize your gums too much. It is also important to be on a low-carb diet. It is important to try and not have these amalgams with these heavy metal toxins, because every time you bite on it, every time you drink something hot or soup or eat a hot meal, that heat will excipiate those, release those heavy metals, mercury in particular. With that, it'll loosen those fillings, and then your teeth will crack. Bacteria can invade into the jaw, and into the bone, and you can get this osteomyelitis, cavitation. Oftentimes, if you have a root canal, there'll be on 3D x-rays pictures of a tooth that had a root canal, and they will see on a 3D, not necessarily the common, but just plain x-rays, they'll see the cavitations. And people, we are not chewing and biting down. There's about 40 pounds per square inch when we bite. And with that bite, remember how I said stomping, and you stomp with your arm and you stomp with your feet? Biting down is also very good. There are some athlete, it's like a necklace that has a rubber loop in it, and it helps you to chew and bite on it, and that will stimulate the bone for growth. A low carb diet will do that. If you fast, I would say about 18 hours, then you're starting to get some secretion of growth hormones that are promoting repair of bone tissue, collagen, elastin, all these things that help us live longer and repair better. So exercise stimulates bone health. Sudden deceleration, like stomping and hitting with a hammer, chewing and putting pressure. Hormones like estradiol, progesterone, testosterone help it. DHEA helps it. So all these things matter. And bone loss in the jaw is an increasing phenomena, I think, largely because of the high sugar contaminated foods that we are eating, and oral infections that are low grade that are generating weakening of the bone and these fillings. So hopefully that's a help to you, Pamela. Deanne asked the questions. Greetings and gratitude to you, Dr. Rita, from North Carolina. Oh, well, thank you, Deanne. I am 84, a B positive blood type, good health, slight frame, had a hysterectomy at 41 years old with endometriosis, began estradiol vaginal cream, a 0.01%, 18 years ago. With osteoporosis, is it advisable to add progesterone? The answer is yes. If so, what and how much? Well, there's only one progesterone. There aren't varieties. Now, the synthetic chemical companies, pharmaceuticals, which I'm very skeptical of, they create things called progestins. This is a whole group of synthetic mimicking progesterone chemicals. And if you can recall back to 2002, there was the Women's Health Initiative, one of the largest women's studies on hormones. And, it was very controversial when it came out in July of 2002. A lot of women became fearful of some of the initial statements about it. But rich analysis and scrutiny over the years looked at it, and they found that the estradiol is really not associated with an increase in cancers of any sort. It actually had a cardioprotective effect, and the progestins were associated with an increased risk for breast cancer. The natural progesterone, and fortunately it was amazingly used in this study, was not associated with any of these harms. I believe any woman who has a breast cancer, this is my personal belief, I am not an oncologist, but my personal clinical experience has been that natural progesterone is a natural modulator of estradiol. Therefore, all women who are concerned about their estradiol levels should be advised that they should not drink any alcohol or be on a high carbohydrate diet. They should be on a low carbohydrate diet, because alcohol is a carbohydrate as well. And they should all have progesterone to help naturally modulate it. So let's see what else she says. How much? Well, there are various ways you can do it. If you want to recreate what God did with the woman's cycle, a woman makes an initial buildup of the uterine lining called the follicular phase. And then there is a ovulation somewhere around day 8 or 10, and the buildup of progesterone for about 10 to 12 days. This is called the luteal phase. During that time, estradiol has taken a drop, but then it has a slow bump up. So women are making estradiol in a biphasic wave every month, like that. Their progesterone is a single wave every month. And so it is, and this is what I do. I take progesterone 2 weeks out of the month. The last 2 weeks out of the month, I don't. I take my estradiol all the time. I don't vary it. I know Wiley of Wiley Protocol. When she was writing her book, and it was just a manuscript, I was asked to read it, and I did back in the early 1990s. I went to her home, and we had talked, and she had a little female group things about it and her trek, and she was trying to recreate those higher estradiol levels and these biphasic levels of estradiol and these higher peaks of the progesterone. It was interesting. It was helpful. It's very cumbersome. It's very hard for doctors to put up with who are not interested in natural. And she would link it to the lunar phase, the moon counting of the days rather than the calendar. And oftentimes people would get messed up. So I use calendars for the sake of understanding simplicity. Number two, I use static dosing. For instance, I'll put a woman on 100 milligrams of progesterone or 200 or 300 or 400, and they're on that for the 2 weeks and then they're off for 2 weeks, or they just stay on the 2 to 3, 400 progesterone all the time. That's to inhibit the uterus in the woman from developing a lining that is responding to the estradiol she is on. Because if you have a normal uterus, the lining of your uterus will respond to your estradiol, and it will develop a bloody lining that wants to shed itself. So progesterone is designed to help shed that lining. So women who are like near 70, like I am, if we do this like the fashion where I'm on estradiol all the time, my uterus will build up with some lining. When I start my progesterone on the 1st of the month to the 15th, this will signal the clean out of it. And then you'll have a very light menstrual cycle around mid-cycle every month. This way I know everything is normal. So I'm a postmenopausal woman who has menstrual cycles or bleeding every month, but it's not a cancer. And why is it not a cancer? Because it is very well controlled. It is very predictable. It is a natural hormone undulation that I would expect. Now, if a woman is on continuous progesterone and a continuous estradiol level, over time, and we do check this usually twice a year with our patients, and I tell them, you have a normal uterus still, then it's possible at some point you may have enough lining that eventually will build up, and then you'll get a little blood flow because you have a uterus. This does not mean, like it did 40 years ago when I went through medical school, that this is always a cancer. That is not the case anymore, because back in the 1970s, almost zero women were on natural hormone replacement therapies. So back then, if you did have a postmenopausal woman who hadn't had her period in years, then have vaginal bleeding, then we did become concerned. But that's not the way it looks to be today. So many women are getting some anti-aging, bone building, heart health, immune health, uh, mental health, sleep enhancing health, skin integrity, cardiovascular health with these hormones and bone health. So um, I would start with 100 milligrams, 200 milligram range, and I would, why not try and see if you can tolerate having a very light, predictable period every month, and that's what I offer. But some women say, no, I don't want that at all, and that's when I tell them, well, if you're on it continuously, you may indeed get a little bit of a breakthrough bleeding, even still, and then we'll do a pelvic exam usually anyway, because you're all women on hormones should have a pelvic. And if all the annual pelvics or every 2 year pelvic, somewhere within a year or two, we do it. And then we'll get an ultrasound every so often to see if that lining is building up or staying very low. Okay. Hopefully that answered your question. Oh, you also said, is it essential to get a hormone panel done? Thank you. Yes, I think if you're going to be on hormones, your doctor and you should be tracking, your, you start it, get a panel in 3 months. Let's see, what have we achieved? And then 6 months later, did it stay in that realm? And then at least once a year, if not every 6 months, for our first couple of years or so, to make sure we have several points connecting. Make sure you get a pelvic in that time, maybe one ultrasound of the pelvis. Harlow asked the question, what do you think about taking goat's colostrum? What are the benefits? Well, this is the initial flow of the breast milk has the colostrum in it, which is rich in all these wonderful fat soluble vitamins and immunoglobulins and immune protective information for the baby developing, the brain developing, all these wonderful things. I don't see any problem with taking goat's colostrum, but I just don't know that you need it. I think if you do intermittent fasting, you're going to still stimulate natural growth hormone. You're going to be getting autophagy, cleaning up of older cells that are going to be cleared up with autophagy. So, although I'm not against it, I don't think you need it. She also asked, do you self-recommend, what do you self-recommend to improve nitric oxide? Well, regular exercise and HIIT training, which is high intensity training. If you're taking a walk.
Okay, I found this on the web for.
Obviously, the phone is listening to us. It decided to answer a question for me. That's spooky. But what isn't spooky these days about artificial intelligence, transhumanism, and technology that's trying to take over everything? But anyway, there you go. What was I talking about? What do I self-recommend to improve nitric oxide? HIIT training is high intensity training where let's say you are walking at a decent pace, but for 20 seconds you decide to walk much faster or break out into a jog, and then just do these little spikes of higher intensity, walk for a minute, then 20 seconds that, or whatever cycle you want to do, 3 minute walk, 30-second higher intensity. That's associated with nitric oxide production. Doing EDTA chelation is associated with enhancing nitric oxide. Using amino acid supplementation like L-arginine and L-citrulline. doing intermittent fasting or doing prolonged fasting is associated with it. I mean, you could go on and on. So that's what I would say. Harlow also says, do you recommend testosterone shots or natural testosterone for men in their 60s to improve overall well? I think you could do both, Harlow. I have men who are on testosterone intramuscular shots once a week or every 10 days, like on the 1st of the month, the 10th of the month, and the 20th. I have men who take it once a week. I have men who take the testosterone every day. I have men who use it just Mondays through Fridays. I have men who have, they dissolve a troche. It's like a soft capsule, uh, like a mint, and dissolve it under their tongue once or twice a day. So there's various ways to do it. I am not in any way at all in favor of pellets. Pellets are adding something stuck under your skin, and it's foreign. It reminds me of breast implants or other implants of other things. I just don't like foreign stuff in the body. And once it's in there, you can't retrieve it if you have a problem. Do you recommend Ozempic for weight loss? Is it safe? No, I don't. And I don't think it's been around long enough to say that it's safe. God bless you, Dr. Rita. Yes, I need his blessings, that's for sure. Uh, and I don't want to look for direction or support from any other source, least of all me. Uh, I want to be God dependent and God directed always. Irene, I have recently recovered from type A flu in mid December of 22. Was treated by a physician's assistant at urgent care, had a chest x ray, was negative for pneumonia, was not informed of any other problems. I returned to urgent care for another x ray 8 weeks later because of lingering non productive cough, sinus congestion, and occasional vertigo. Had another chest x ray, and attending doctor told her it was negative for pneumonia. However, noted a small nodule on the right lung. He further stated he compared December x ray with the February x ray, and nodule was not had not appeared to change in any size. He felt that if it was cancer, it would have increased in size. What further lab and or imaging tests should be done for more information regarding the nodule? You're, she says she's still having fatigue, some trouble sleeping, and occasional vertigo. Well, Irene, this should be shared with your primary care physician who can monitor this with you rather than whoever pops up at these clinics. And they try to do the best thing. And if you're not the regular recurring doctor, you're going to, like an emergency room physician, you're always thinking, what could be the worst thing so I don't miss it and warn the patient because I may never see them again. And that's kind of how I operated as an ER doctor. But as we all age, we're going to have nodules and cysts and lumps and tags and things. It's just a part of aging. And the vast majority of all these are not concerning. But to have it repeated in over a period of time and they're stable is very reassuring. The mere fact that yours was about 8 weeks apart is a narrow window. I would probably see your primary doctor or anyone who is following something like this and have a longer term repeat x-ray done, a simple chest x-ray. They can do a CT chest of this and look at it more discreetly if they have any concern that it changed. And I would work this with your primary care doctor. But it sounds quite benign. It sounds quite stable. We are in an environment as we age, our recovery time lengthens, our fatigue lasts longer. And if you're not taking a diet that is low carb and enough vitamin D, it's going to be harder to recover. So, Irene, I don't know your age. I don't know if you have other comorbidities, hypertension, diabetes, asthma, or anything else. But this is why we should have a doctor that you can follow up with and follow you through and reassure you. Anytime we get congested with allergies, the mucosa can swell, the sinus can get clogged, the pressure has to get absorbed, bacteria try and grow. If you're high carb, fungus can grow. And the eustachian tube can be clamped down and you can feel pressure in your ear. But the same thing can be happening deep in your ear in your loops of Helene, which are 3 loops in 3 different planes. The horizontal, vertical, and then tangential loops, so that when you turn your head one way, the water fluid flows one direction. When you lift it this way, it flows this way. When you go that way, it goes backwards. So it's always feeding back with the flow dynamic of the loops of Helene with the little hairs in it and the otoliths. It's sending information about your spatial orientation. As we get congested, these little areas become more sensitive and have less variability tolerances. And when you get less variability, less tolerance, you can get maybe one loop is not flowing correctly, and then your body is kind of like, what's going on? What's going on? And your sense of balance orientation goes off. That's called vertigo. So eating a low carb diet, drinking enough water every day, taking a little Pacman enzymes to clean everything up in our body on an empty stomach are extremely valuable. Getting a good night's sleep, having an empty stomach long enough, try to be 18 hours a day without eating, so there's more time for cleansing in the body. All right, so that's that page. This one is David. What are your thoughts on taking magnesium L-threonate 2,000 milligrams with L-threonine 200 milligrams and apigenin 50 milligrams for assisting with deeper, more restorative sleep? I think it's well known magnesium is a muscle relaxer. With L-theanine is very helpful in neurocognitive production, neurotransmitters. The same with apigenin. I don't see any reason why I wouldn't take it, David. So why not? Let's see. Terry says, "Hi, Dr. Rita. I have a friend who is fighting stage 4 renal cancer. It has spread to her liver and a small spot on her left lung. Is there anything you can recommend that can slow the process or help her in any way?" There's a video out there called Cancer as a Mitochondrial Metabolic Disease. Cancer as a mitochondrial metabolic disease. Put out by Dr. Seyfried. He is a super duper biochemist, and he's the one who puts out much of the research on these very serious, dangerous cancers that usually are with poor prognosis. Dr. Seyfried is well regarded for extending the life of these people on what we call the carnivore diet. The other thing is high dose vitamin C research. The Reardon Clinic in Kansas has quite a few renal case studies reported. There is research on ivermectin and as a daily dose at about 0.4 milligrams or 0.3 milligram per kilogram used once daily, and the association with that, and some improvements. EDTA chelation therapy improves the microcirculation. Selenium. I would go to acam.org and try and find a doctor who is experienced with a high dose vitamin C intravenous therapy with chelation therapy, who would be willing to look up ivermectin and renal cancer research. It's very promising. Who would be supportive of looking at cancer as a mitochondrial metabolic disease with the very low carb diet. That's a carb limit of, let's say, 15 grams of carb per day or less. Prolonged fasting. Some people do a prolonged fast, like 21 days. They're on a water fast with multivitamins and minerals, and have significant breakthroughs. All of these things are metabolically typically oriented and stimulating autophagy through the low carb diet, and also through suppressing growth promoting factors such as insulin by the low carb and fasting lifestyles. So those are the things I would look into, Terry. Debbie, thank you for all your blessings of healing information. Well, thank you, Debbie. My question is, berberine seems to be so helpful. Could you share some specific benefits it has for us and why you use for your patients? Love you. Well, thank you, Debbie. Well, berberine is an herb that they modeled the drug metformin off of. So they changed the structure of the herb berberine to a chemical a little different so it could be patented. And it is associated with helping with the sugar metabolism in the human body. And the name of that medicine is called metformin. Berberine is also associated with improved liver functions, probably largely because it helps the liver to process sugars. And I would say that's the greatest benefit why I use berberine every day of my life. Our product is called TLC Metabolic Formula, and I use 2 twice a day. And I enjoy fasting blood sugars that are nice and low. I think my last fasting blood sugar was 62. Yeah, 62. So I feel wonderful all the time. Debbie also said, hi, my daughter Megan has a damaged artery from having surgery on her lower right side, which causes her leg to go numb. Orthomolecular has a new product for arterial health called Glycocalyx Pro. And I was wondering if that would help restore a damaged artery, or what you think of this product. Thanks so much, Debbie. I know of Glycocalyx Pro. It is partially some of those enzymes that we talk about that are in like Vascuzyme or Vitalzyme. And yes, it is helpful. So I would think it would be helpful, but you got to drink enough water. And you have to stop eating by 6 o'clock. You have to have an empty stomach about 18 hours a day to stimulate the healing. So you have to do many other things other than just take a product. That was called Glycocalyx. Cynthia said, is there something that would cause the anti-nuclear antibody, ANA test, to read 1 to 1,280 speckled, but all additional blood tests for specific autoimmune diseases to be negative? I find that this is typically associated when it's like that. My experience as a clinician of 41 years practicing is that it's heavy metals. When I do EDTA chelation with anyone with anti-nuclear antibodies, I I would say I would 99% of the time see it drop dramatically. Uh, after maybe about 10, 15 IVs. So I don't know, was there recent dental work done where there are mercury amalgams taken out? Anyway, that's what I have found. Another question, if possible, is having a B12 level of 1,566 something to be concerned about? No, because it's water soluble. I don't take supplements that would cause it to be high. I actually have symptoms that would suggest low B12. Okay, so you could have a higher measured level, but functionally it's not getting to do all the work it needs to do. You might need also other B vitamins, and you might need other trace minerals or minerals, and you might need betaine hydrochloric acid digestive enzymes to help in many ways. Sean says, can you share your thoughts on the role and benefits of nitric oxide has on the body and how best to maintain healthy levels through food and our supplementation? Thank you all for all you do for the Health Freedom Tribe. Yes, Sean. I would do high intensity training. You don't have to try and do it like an animal, but I mean, if you do that run, brisk walk and then sprint for 20 seconds, and you're doing that, 3 times a week. Weightlifting helps stimulate nitric oxide. EDTA chelation IV helps stimulate nitric oxide. L-arginine, the amino acid, helps stimulate it dietarily. L-citrulline seems to be even better than L-arginine. Certain herbs are helpful. I don't recall them right off the bat like this, but those are the things I would do. Plus a low carb diet, fasting, and a good night's sleep. So that's the rest of those questions. We have some more of these questions here on the chat. Okay. Tiziana. Hi, Tiziana. Hi, Dr. Rita. Recently, functional medical doctors talk about HRV, heart rate variability. No, that's not recent. That's been around decades. What is it exactly? Is it better to have high variability or low? High variability is better. Why is it important to monitor? Thank you. Well, if you've ever watched a little baby or you watch a very young child and you're watching them sleep at night, and you can actually see the heartbeat. Sometimes the little baby is so thin, you can actually see the chest pulsing. And when you take a breath in, the heart rate will start going quicker. And when you breathe out, the heart will slow. When you breathe in, the heart rate will go quicker. When you breathe out, the heart rate will go slower. So the vagus nerve is very healthy and uninjured. And so the vagus nerve is involved in this. And so the sheath, the lining of the fat is all beautiful, insulated without these breaches, damages to the lining on it, like in that picture there on the wall. So heart rate variability shows that your system is ready to respond in a second to the changing environment, and that's a very healthy sign. And that has a great predictive value of good health. Hopefully that helps you, Tiziana. All right, Constance, do you believe in the concept of ketosis? Do you ever eat any bread ever? The answer is yes, I do eat bread sometimes. I do believe in ketosis. If I eat a piece of bread, it'll knock me out of ketosis for sure. I have probably an 80-20 rule. 80% of the month, there's nothing like that I'm eating, or 80% of the day. But the 80-20 rule is usually what I live with. Now, there are some people who are so sensitive to grains, they can't even tolerate an 80-20 rule. So I would say ketosis is going to be stopped because bread has a glycemic index of 100. It's a reference point. It will stimulate so much insulin, and insulin is going to stop ketosis or fat burning. Ketones come from chopping up little pieces of fat into triglycerides and smaller ketone particles. And so if you eat any carbohydrate, you're going to lose the ketosis. What's the next one? Christina says, hi, Dr. Rita. Any tips to relieve headaches, migraines? Thank you. Well, it will sound redundant. Water. It's the number one thing I've ever seen to consistently impact headaches. So half of your weight in pounds, if you're a 150-pound woman, 75 ounces is the minimum you should be drinking a day. Number 2, sleep. Get the electronics off, get the phone away from your head, get the computer shut off, get blue light in your lenses to filter some of these electromagnetic frequencies to your eye gate, and go to bed more close to 9:30, and try and get up at 4:35. Exercise. Exercise is always associated with better circulation, reducing inflammation, and you'll have less vascular spasm, contraction, and swelling, edema of the vasculature. A headache can be sinus mediated and spread, or it can be the blood vessels. The brain itself has no pain receptors. It's the lining meninges and the blood vessels. That's why you get throbbing headaches, because something irritated the lining of your blood. You could have eaten something, so food allergies, a wild, entertaining diet of all kinds of things, whatever you all want to eat, is sure to trigger inflammatory symptoms in your body. So if we eat more humbly and we say, I'll have only real food, nothing packaged, I'll have a more simplistic steak and broccoli day, and I'll have a day where I'm having chicken and green beans. So the less I'm asking this immune system to do, the less likely I'm going to trigger inflammation to the rest of my body. Magnesium, mineral deficiency, is the number one mineral deficiency for relaxing the smooth muscles in your blood vessel vasculature. Taking consistent magnesium is usually always helpful. What else? Low carb is a given. I think I've covered some of the major basic ones. Enzymes, if you do have a headache, rinse your nose with Argentyn silver, drink plenty of water, and take like 5 to 8 or 10 Vitalzyme or Vascuzyme and fast for 24 hours. It usually knocks any headache out. What else do we have here? Constant asks the question, what benefit is there for a healthy 70-year-old woman who has gone through menopause to take hormones? Well, there's all kinds of benefits. It is slowing aging. It'll extend your life. It'll build your bones. It'll help your sleep become deeper, more restorative. You'll feel more refreshed. It'll sharpen your memory. It'll improve your skin barrier and the function of your skin. It'll help with elastin collagen, not only in your face and reduce wrinkles, but it'll help your joints and your ligaments throughout your body so that you can use your joints longer. It is cardioprotective. It is immune enhancing. It is emotionally stabilizing, just to mention a few. Jennifer. Hi, Dr. Rita. In the event of a nuclear radiation event, how much potassium iodide should we take? Daily current is 12.5. Will we double or triple the daily dosage during a radiation event? Honestly, I would say 12.5 is plenty. And I don't think you need any more. Now, I take that much every day myself. I have for years and years and years. At most, I would take 25 milligrams. That's a topic in and of itself. And since we're already at 7 o'clock, I'm going to go ahead, since I've been up from 5 o'clock and I worked a full work day on top of everything today, I would like to go and go home and rest and get ready for tomorrow's work and for the patients I see tomorrow. And so to all you dear TLC Health Freedom Tribe, I want to say thank you. Pray for peace. Pray for God to speak in the hearts of all of us, to lead us to see each other with respect and dignity and how we're made in His image, and that we should be concerned about our brothers. But you basically show it in your own life, taking care of yourself, to your family, to your children, to your spouse, to your parents, treating them with respect, elder care, and then at your work and your long suffering, all these things. It would be such a much better world. And with that, I would say have a good night's sleep and let God take care of things. You know, He's in charge, and not to worry. All right, let's see. Robert Hertzberg says, good evening. Thank you for your amazing health you have helped me to enjoy. I've been increasing my recumbent trike riding mileage and would like to know how to eat for endurance events. Robert, I will get back to you. Okay, so I'm going to get some sleep and rest now for myself, but I'll get back, Robert, to you on that. All right, God bless. Good night, everyone.